Namaskar. Good afternoon. This is the month of June. Usually, worldwide, in the month of June, we spread awareness on professional wellness. All of us are working as a professional in some hospitals or in some IT infrastructure. There are many aspects when we are working in a professional segment, and many of the times we face stress and stress related diseases. So as our employee wellness program, today we have invited Dr. Pranjal Sharma, our psychiatrist and de-addiction specialist. He is trained also, certified in geriatric mental well-being. So today we are really very happy to have you here with all of us. So we thought in entire month we will do many activities, but today let us dedicate for our employees. Because we always know if employees are happy mentally and physically, this will reflect as a team, a strong team, and which will lead to a strong organization. So today I would like to invite Dr. Pranjal Sharma to share your valuable experience with all of us. Thank you so much.
Good evening, everyone. At the onset, I would just like to thank the management of Tulip Hospital for actually bringing up this topic, which is one of the most essential topic, and it is the need of the hour. Mental health and mental well-being is the need of the hour. And also, I express my gratitude for giving me the opportunity to share my views with you all regarding this important aspect of our life. So, just before beginning, actually, I would like to introduce myself because this is probably the first time that I am meeting all of you, as I've just joined as a consultant psychiatrist in Tulip Mediworld in the previous month. So I am a consultant psychiatrist, and for probably most of you know that the Department of Psychiatry is a branch of medicine. It's a branch of medicine that basically deals with people who are suffering with mental illness. Not audible? The people who are suffering from mental illness. So commonly, when you meet many people, they say like, I'm suffering from depression, I'm suffering from anxiety. But not necessarily every one of these persons who are going through these difficult times are actually having a disease state like depression or anxiety. Because all of these are emotions which are natural, is a part of natural human experiences. Feeling negative emotions, feeling positive emotions, these are part of our natural human experiences. So, with these words, I would like to start with this presentation today. Where I would like to, make you aware about what wellness is and how mental health affects the way we think, we behave, and how it impacts our performance in our day-to-day life. So let us start with understanding the concept of wellness. When we say wellness, what does it mean? So wellness is a very broader term. It's not just a person who is free from any disease or illness or disability. Wellness, it encompasses two very important aspects of our life. One is our emotional well-being and another is the social well-being. So by emotional well-being, what we mean when we say that a person is having a good emotional life? So it means that the emotional experiences that a person has. So there are, in general we say there are two forms of emotions. One is positive emotions like happiness, joy, satisfaction. These are positive emotions. Whereas there are negative emotions like anger, like fear. These hatred, these are negative emotions. Now, an emotionally stable person, a person who is emotionally in a state of harmony, will experience the positive emotions like joy, like happiness, like success. But at the same time, he will also have the ability to regulate the negative emotions in a way that helps the person to grow in life. For example, like if you're in anger, if you're in sadness, if you're in a fear of failure, and this fear is not letting you perform in your work, is not letting you talk with your friends, is not letting you perform your responsibilities towards your families and others, means that you are not able to constructively regulate these negative emotions. So it's very important a person who is emotionally stable will experience the positive emotions, at the same time will be also able to regulate the negative emotions so that it negatively does not impact the personality of the person. Okay? Another thing about emotional wellness is our ability to understand, like how our emotions affect our behavior. For example, if you are angry with someone, if you are angry with your colleague, if you are angry with your boss, or if you are angry with your spouse or someone, so how does that anger affect your behavior? So when you get out of your home, you come to your workplace, and because you are mad on your wife, the moment you start seeing the person in your workplace, you become irritable. Someone is asking you, do this job, you have to do this today. So you get irritable. No, I am not going to do this today. I don't have time today. So how did that emotion, that negative emotion of anger affected your behavior when you are coming in interaction with people? That is important. So the ability to understand how our emotions affect our behavior is a part of emotional well-being. And if we are in a harmony with all these things, if everything is in a balance, like your positive emotions, your ability to regulate your negative emotions, your ability to understand how your emotions are affecting your behavior, if these things are in a harmony, it means that you are also having the ability to overcome challenges in life. This is what, in terms, it's called as resilience. So it develops with your ability to understand, to regulate your own emotions. Similarly, when we talk about social well-being also mentions a person's well-adjusted social life. All human beings are social person. So it's important to have the ability to form relationship, to have the ability to maintain relationship, to have the ability to meaningfully interact with people, have the ability to understand if someone is in pain, if someone is happy, if someone is sad, and then regulate your own emotions and express it in a way which is relevant to that context for the person. So this is what social well-being is. So in return, you feel a belongingness to a community, that you are part of a community. All of us are working over here. So we are, as a community, should have some common social interactive ways which are meaningful to each other. That's very important. So wellness, therefore, is not just absence of disease. It's not that you are having a great physique means that you are having wellness altogether. It may be that you are emotionally not well, or you may not be socially that adjustable. So if these things are absent, the wellness concept is not completely applicable. So when a person is physically, is socially, is emotionally in a state of well-being, then the person's productivity, his self-confidence, his efficacy, everything increases. And when it increases, it in turn helps to contribute to the society at large. So today, if we all of us are having in this state of emotional stability, social stability, and physical stability, so every one of us will contribute to the part of our job that we need to do. And in return, the bigger output, the bigger results will be that the hospital or the hospital's name is going to flourish only because of the quality of service that you're giving. And that quality of service can only come when you have the three parts. You have your physical stability, you have your emotional and your social stability. It's an utmost requirement. So then what are the factors? So what are the things that affect our well-being? So these are some of the common factors, like physical health, mental health, our social relationships, our financial status, our relationship qualities, and our workplace. Now all these factors are protective, as well as these factors are also vulnerability factors. Meaning that if you have these factors can positively affect your well-being if they are in place, if they are correctly in place, and they can negatively affect your well-being if they are not correctly in place. Suppose you are physically fit, that will positively affect your well-being. Whereas if you are sick, if you are suffering from some chronic disease, your level of fitness, your level of well-being will be less. All these factors, if you are having mental health issues like anxiety, like depression, so these factors are negatively going to affect your well-being. In return, will reduce your ability to perform in your place of work. I'm not going in detailed explanation because I think most of you will understand the relationship between these things. Then what is stress? If what we have discussed is well-being, then what is stress? So there are a lot of definitions of stress, but I think one of the most practical and understandable definition of stress is it is a response. Stress is just a response to a perceived or a real threat that comes in our life. So this response has three forms. One is a physical form, one is emotional form, and another is behavioral form. So what is the physical form? How does our body respond to stress? So when you are faced with a stressful situation, the first response that comes is our physical response. So this response is basically mediated by our autonomic nervous system. It's a nervous system, part of a nervous system which functions on its own. It's an autonomic nervous system. So what happens when we are faced with a stressful situation? So our heart rate may increase. So we feel palpitation. Our blood pressure may increase. So we feel lightheadedness, we feel headache. Our respiration changes. The respiration becomes short, shallow, and rapid. There will be sweating. We may sweat a lot. Our hands and feet may become cold. There will be tremors in our hands. So these physical symptoms are mediated by the autonomic nervous system. It happens on its own. We do not have any control over it. When we are faced with a situation which is very much threatening to our integrity and identity. The second is the emotional symptom. So the moment when you hear something, some bad news, or you hear about a traumatic event, there is a series of thoughts and emotions that comes to our mind. So these may range from, immediately feeling fearful, feeling nervous, feeling sad, feeling hopeless, feeling worthless, feeling guilty about what has happened, why it has happened. So these emotions are part of a response to a stress which may be actual or which may perceive. So there's a difference between a perceived stress and an actual stress. Most of the time, the stressful situations that we come across is a perceived stress. It is how we think about the situation that makes us feel these emotions. But probably the actuality or the severity of the threat is not there. We just assume it. Sometimes it happens. The moment you get a call from the emergency department and they say that there is a patient that you have seen previously, now the patient is in a bad shape. So the moment a lot of things comes to a physician's mind, like what has happened to the patient? Did he suffer from some side effects? Did he overdose himself? What was it? So unless and until you face that situation, your mind will be playing with all these emotions, like maybe that I have done a mistake, maybe that something was wrong, he took an expired medicine, a lot of things will come in. But these are perceived stress. Unless and until you go and stand and see the patient and you will understand, okay, then the level of stress will come down. But till then, it is perceived stress that will make you feel all these emotions. And when you feel these emotions, accordingly you also start acting. So under stress, people usually, they act out in two ways. Either what we call is an externalizing type of behavior, like you'll be very arrogant, you'll be quarrelsome, you'll be irritable, you're fighting with everyone, not doing these things properly. That is one way of expressing our frustration. Then other way is like becoming withdrawn, not speaking to anyone, getting isolated, staying alone, getting detached from whatever he or she was doing. So there's another way that we express our stress. People also start using a lot of substance under stress. Some people, they start consuming more of cigarettes, consuming more of alcohol. So this is again a maladaptive behavior that occurs under stress. But actually, stress is not always bad. So it is a protective mechanism of our body. So the moment we are faced with a threat, it's a defense system of the body to minimize this effect of stress, to minimize the effect of the stressor. So then, is stress always bad? No, it is not. Because if we want to classify, we will say that what are the type of stress, then we have two forms of stress. One, what we call as eustress, and another what we call as distress. A eustress is something which is called as good stress. It will increase your motivation, it will bring excitement, it will increase drive, it will force you to achieve your goals. Whereas distress is something just the opposite. It will instill fear inside you, it will instill doubt, self-doubt, it will instill like, I don't have this ability to do. This is too much for me, it's overwhelming, I cannot do. So that is when it becomes distress. And it reduces our productivity. So let us understand how these two things are related to one another. How eustress and distress are related. Now this is a very simple drawing, you will understand just by seeing it. If we plot stress, in other terms arousal, in the x-axis and performance in the y-axis, you can see that when the level of arousal is low, means there is no demand, there is no pressure, you have nothing to do. Your job is like you come and sit idle for 6 hours and go back home. There is nothing, no pressure, nothing. You just come and go. Then there is no performance. So you can see the performance is also weak. But as the stressors increases, as the demand increases, the performance will also increase. But to a certain extent, the optimum arousal will produce an optimum performance. But that is the critical point. And this is what we call as a threshold of a person to perform under pressure. Every person has their own threshold to perform under pressure. So this peak of this curve is that threshold which a person can perform under pressure. Beyond that point, if the stress continues, if the demand continues, the performance gradually decreases. So this is the point when stress has turned into distress. This is the point where even if you have your skills, your ability to do things, but you are not able to give the output. Only because you have crossed the threshold. That, in terms of work, is what we call as burnout. So you have everything, you have your skills, you have your experiences, but then the pressure is so much that even with the good skills, even with your experience, even with all the resources that you have, you are not able to perform. So we have to be very mindful about this thing is what is our threshold to perform. And when you feel that pressure that you are not able to do it anymore, it is the time that you seek help from, say, your friends or your support system, any doctors or therapists. That is very important. You have to understand that I have my own threshold of performing. I can perform to that level. If someone is persistently pushing me beyond that, that is the time when I can break down. So that is my threshold. And it's important that you communicate with your friends, with your seniors, with your management, that okay, probably I need some help, probably I need some assistance in what I'm doing. So that can resolve the problem. Then how do we deal with stress? How do every one of us deal with stress? So this is a very simple, I think everyone will be able to relate it. Every individual maintains a balance of his, well-being between stressors and the coping. Every one of us go through day-to-day basic or maybe certain more stress in our life. But if we are having the skills, if we are having our experiences, we are having the resources to deal with those stressors, then the balance is always maintained. Right? By skill, what I mean is the knowledge to solve the problem. When you are faced with a problem, you have the knowledge to solve the problem. That is skill. What experience brings is our ability to implement that knowledge. I know the steps of solving a problem, but I don't know how to start, where to start. That is where I lack experience. If I'm skillful, but if I'm not experienced, probably I may fall under the pressure of stress. And the third thing is resources. Resources are everything. What is required to fulfill the task? It may be a place, it may be an instrument, it may be any simple thing that is required to complete the task. If these things are there, then most of the time, the coping is more than the demand. So that will lead to a positive outcome. You will be able to overcome the stressors or the challenges that you face, and then you give positive results. But in case you do not, if you lack in any of these skills or experience or resources, maybe that the coping is less than the demand, and in that case, it will lead to a negative outcome. So there is another scenario over here. See, just now that what we have discussed is like you have your skills, you have your experiences, you have all the resources, but the demand is severe and persistent. If it is present all the time, for days, months, years, that will lead to a state of exhaustion, even if you have the best of your skills. And in that case, it will lead to a negative outcome. So in work culture, this is what burnout means. This is what probably some of us have also experienced. Even like during your training time, during your study time, or probably right now, even like when you are working, there are a lot of demands, not just from your workplace, the demands from your family, your responsibilities towards family, your financial issues, you have a lot of other things that you need to be taken care of. So all this sum up, and when you are in your work, there is a constant pressure to perform better all the time. Even if you have the good results, even if you have done the best, but still there are pressure and you need to do it. So that is when a burnout happens. So gradually as we progress, we'll also understand how we can deal with those situations. Now what happens to our body when we are under stress, when these difficult or challenging situations they exist in our life for a very prolonged period of time? So what does it happen? Usually stress has its manifestation in these 5 domains of our life. It is not necessary that all of these symptoms will be present in one patient or one person. This may present in a variety of combinations, but yes, these are the things that any one of us under stress will experience. Some of these are physical symptoms. Like we may have headache, we may become easily tired, even if you are not doing too much of activities, but then you feel tired constantly. There are a lot of bodily symptoms, joint pain, muscle pain, burning sensation, stomach upset, loose motion, constipation. These things are there which are part of what we call as the physical symptoms of stress. Then the emotional symptoms, like we have discussed previously, fear, anxiety, depression, hopelessness, guilt. These are all emotional symptoms. Behavioral symptoms, like either you become aggressive, irritable, or you become withdrawn, detached, isolated from the community. Cognitive symptoms, like your ability to focus on your work decreases. Your ability to retain what we call as a working memory. So when you are on a task, we work with our working memory. Means that we know that these are the things that we have to do one after another. So our cognitive, our brain function, it suffers in that way. That this is done, then I have to do the second, then I have to do the third. So when you are under stress, there is a stage of where you do not have the clarity in your mind, like what you are going to do, what you have to do. Even if you know those things, but under stress, you will not be able to clearly, take decisions and make decisions, do the right thing at the right time. So these are cognitive symptoms, and obviously biological symptoms. The most common that we come across in our day-to-day practice is insomnia. People say that I cannot sleep. I cannot sleep because of my worries related to work, worries related to finances, my child's care, my spouse not staying together, a lot of things. So this insomnia, poor appetite, substance use, weight loss, even low sexual drive, these are all related to stress. Similarly, at the organizational level, what happens when all the employees in an organization, if they are under stress, what is going to happen? Because they are not able to function properly, health-wise as well as emotionally, they will start avoiding responsibility because they know the moment they come to work, there will be a lot of things that they will be burdened upon. So the best way is to avoid. I'll not go. I'll take a leave. I'll say I'm having diarrhea, I'm having headache, I'm having fever. So absenteeism increases. Second thing is, since you are not regular in your work, since you don't feel like coming to your work, you will also start not liking your work. There is a negative perception about your work. And so you will always think of moving to a different work. So in that way, there's always a tendency to leave the job and go to something else. So in return, that will increase the manpower turnover. The workforce keep on changing very frequently. So when the workforce keep on changing very frequently, it needs to be understood that the organizational level, there may be something which needs to be corrected. There is frequent accidents because of carelessness, because of inattention, because of inability to take decisions. There will be frequent accidents. And the cost of healthcare services towards that the organization bears towards its employees, that is going to increase. If you are frequently admitted, suppose your company is giving you a policy, health policy or a health support like monetary support. So every 2 months, 3 months you are getting admitted, you are getting treated. So the cost of your healthcare, the burden is increased for the company. This is how stress affects our wellness. Now these are some of the warning signs. So this you can ask yourself, like, do I get tired easily? Even if I am not working, I am rest, but I am still feeling tired. Do I get irritated easily? So my 2-year kid is coming and calling me Papa, Papa, and then I'm just seeing and I'm feeling, like, go away, why are you hitting my head? Does that happen to you very frequently? That innocent 2-year kid is a source of your irritation. That doesn't seem like a normal thing that should happen. So, are you taking too many leaves from your work? Do you fear going to your work? You are not able to concentrate. You forget things too much. And then you feel that it's better to die than to leave. There are a lot of physical symptoms that are there. You find difficulty falling asleep. Your appetite is low. You take the help of substance to relax yourself, relieve your stresses. You lose interest in things that you were previously enjoyed. It may be a sport, it may be music, it may be cooking, gardening, anything. But then gradually you are losing interest in all those things. If these things are happening, then it is a partner. It's a warning sign that you have to monitor it before it progresses to the disease level. Just having these symptoms does not indicate that you are suffering from a disorder. But if these symptoms, they are persistent, they are staying for say months after months, then probably yes, you are having a disorder and you need to be treated. then how do we manage our stress? The very first thing that we need to understand that there is by no means we can eliminate stress from our life. It is an indispensable part of our life. It will be there with us always. The only thing that we can do is to learn to deal with it. Learn to deal with it in a way which is constructive. So, therefore, it's important to understand the difference between a real threat and a perceived threat. So, is it an actual stress or is it that I'm just perceiving? Because most of the time, we perceive the situation to be threat. But actually, it is not that threatening. Then look for the causes. If you can identify all those factors that we have discussed, if you can identify, like is it from my physical health, is it from my mental health, is it from my social side, my financial side, my relationship side, is it from my workplace that I'm getting stressed? Try to find out the cause of your stress. And then also identify, recognize the effect of stress early so that you can take that intervention at the right point of time. So this is how we should view stress in our life as. Now managing our stress is a very basic thing that we are starting. All of us know nowadays that around the non-communicable diseases, that is the most prevalent disease in developing as well as in developed countries. It almost around 80% of mortality and morbidity is because of non-communicable diseases. And these non-communicable diseases, these are basically the result of poor lifestyle choices that a person makes. So lifestyle plays a very significant role. Diseases like obesity, hypertension, cardiovascular diseases, infertility, these diseases are all lifestyle diseases. They occur to a person only because of poor choices in the way they live. So it's very important, that we focus on improving our lifestyle. And the very first thing that comes in managing our lifestyle is like what we eat, how we are, how we are fueling our system. Most of the patients who come to the OPD who are under stress, they use a common term that, sir, I have this stress eating habit. Whenever I am in stress, I have a tendency of eating a lot. I eat sweets, too many sweets. And I feel like eating junk foods, fried foods, this kind of thing. So, that maladaptive behavior is a result of the disease. That will maintain your illness. So it is important that we understand that even under stress, it is our responsibility to eat mindfully. Eat foods which are low in calorie. Eat foods which are high in fiber. Eat foods that have a good, nutritious vitamin, mineral quantities like fruits, salads. Eat foods that are rich in omega fatty acids, what we call as good fat. You have to be mindful, even under stress, even under worst scenario that is going in your life. Still, you will have to be mindful of what you are eating. Because if you eat right, only then your body is going to function right. Second, again, eating, if you are not eating right, you will not be having an ideal weight according to your height. So when you are not having an ideal weight, means either you are overweight or you are obese. And obesity or overweight, these are again, there are risk factors for diabetes, hypertension, cardiovascular disease, infertility, anything. So it's very important that even under stress, we maintain our weight, we eat properly, we exercise regularly. Because exercise does not just mean that it will make you physically fit. Biochemically, when you exercise, when you work out in any form, it may be like strength training, it may be gym, it may be running, yoga, anything, it releases endorphins in our body, which is basically a hormone that helps to control the level of cortisol. Because under stress, the level of cortisol will be high. And only doing, exercise, a little bit of exercise, 30 minutes of exercise a day can release enough of endorphins that will help to regulate the level of cortisol. Adequate sleep. Now, this sleep is basically the restorative machinery of our body. Whatever wear and tear that the body goes through all throughout the day, the moment you have a good 7 to 8 hours of sleep, it restores all the required things for our body. So, utmost priorities should be given to sleep, and sleep hygiene practices should be followed by all. Then maintain a routine. Now, why a routine is important in our life? Routine means you are doing everything that you do in a day in a specific order, in an organized form, and you do it every day. It's not that Monday I will be, very disciplined, and by the time I reach Friday, I am a zombie kind of person. No, it's not. It has to be routine every day. You fix your daily chores in such a way that it has to be done at that particular point of time every day. When you maintain a routine, it will help you to manage time. When you can manage time, it gives you an opportunity to balance your work and your personal life. Because that is very essential. It's not just about work all the time. You have to have time for your families, for your own self, for recreation, for social activities. You will have to have those times. Unless and until you have those times, you will not be able to maintain yourself in that well-being state forever. So it's important that you maintain a routine. And hobbies, whatever you feel like. A hobby is something that makes us relax. It makes us feel happy. It makes us, the sense of accomplishment that although I have been running like anything, and then by the time I reach home, I took my guitar and I played a song and I feel very happy. So that is how hobby helps. It helps to relax. It helps, again, reduce the effect of the stress that you go through also. It may be anything. It may be your hobby may be sport, your hobby may be running, your hobby may be singing, playing music, anything, gardening, pet, cooking, anything. But do it regularly every day for at least 30 minutes. Religiously, just like you do exercise. So it's a basic thing that we can do. This is something which is totally under control of every individual. Lifestyle choices is something which is totally under every individual's hand. Other than that, there is nothing. You do not know how the world is going to function tomorrow. What is going to happen in the next 10 minutes, you do not know. But what we know is that what choices I can make for myself in these aspects of my life. So this is something which is in your hand, and this is the foundation of being in a state of well-being. Then, as you have said, that we cannot eliminate, we cannot remove stress from our life. Stress will be there. Then if it is there, then how should we approach it? How should we approach to minimize the stress? So there are two ways. One, what we call as a problem-focused way of dealing with stress, and another is an emotion-focused dealing with stress. Now, what does this mean actually? So when you are faced with a challenging situation, first thing that you need to ask is, what is the problem? Is there a problem? Is there actually a problem? That I am thinking that there is a problem, but there is no problem. And if there is a problem, then can I change it? Can I do something for it? Can I do anything to correct it, remove it? If yes, then we have to see, now is the time right to do it? Should I do it now or should I wait? If I can do it now, then I will do it now. But if I cannot do it now, then I'll have to wait. So when I have to wait, it means that I will have to contain my emotions. I will have to regulate my emotions. Just a very simple example. Every day I go through this. Every day I come out of my home, I think I'll reach my hospital by 9:30. And every day I get stuck over here for an hour. So is there a problem? There is a problem. It is not under my control. So the problem is there, but it is not under my control. I cannot say that you remove this bridge and let me go first. Remove others, I will go first. You cannot do that. So when I get stuck in the traffic, every time I have this feeling in my mind, oh shit, today also I am late. What the people will think? My employers will think that I am taking my job very casually. There are patients waiting in the OPD, what they will think that the doctor is not punctual. So there is something. And all the time that I sit over here, these things play in my mind. This is the emotions that come in my mind. And then I feel angry. I feel frustrated. Like when this is going to get over? When the roads will be free? Right? Every one of us go through this. So at that point of time, when I'm sitting in the car and I know the problem is there, I know I'll change it, or I can change it, or it will change someday. But at that point of time, it's not going to change. So that is not the right time that I can do anything to change the problem. So I'll have to wait. So when I'll have to wait, it means that I'll have to contain my anger. I'll have to tell that it's okay to be frustrated. It's not just me, there are hundreds of cars waiting, all of them are late for their job. So the moment I develop a different way of thinking about it, some amount of stress goes out. And then you play the music and chill. So that happens. That is, you have to regulate your emotions. So this is a situation where we have the ability to change, but then it's not the right time to change, so we cannot change. And therefore we have to wait till the right time comes to change. There is another situation. One of your relative dies. Very close to you, dies. The moment you hear it, you are very tearful. You cannot accept the fact that he has died. Now, is there a problem? Yes, there is a problem. The person is no more with us. He is a very dear friend of mine, but he is no more with us. Now, can I change anything at this point of time? Is there a way that I can make the dead person alive? It is not. So, the only thing that I can do is regulate the emotions that are inside me at that point of time. It's okay. If I feel like crying at that point of time, I can cry for some time. But then my focus will be in regulating the emotions. Then my focus will be not, finding a problem, a solution to the problem. Because the problem is irreparable. It's a permanent problem. You cannot do anything about it. So in that case, you will have to accept the fact that okay, there is a problem that cannot be changed, and it's better that I, change my perspectives, my emotions, my way of thinking about it. And that is when we come to these things like how do we manage our emotions? The very first thing that when you are in a situation which is very helpless, you do not have the power to change the situation. So when you are in that situation, the first thing that you need to do is identify and recognize your emotions. What you are feeling, what actually you are feeling. You are feeling sad, you are feeling angry, you are feeling resentful. What is the emotion that you are? And you level that emotion. You give a name to that emotion. That I am feeling angry. Because I am stuck for an hour in this traffic, I am feeling angry. So you give a name, you level that, you identify it. So the moment you identify, you have to acknowledge the fact and you have to validate your emotion that this is a normal emotion that most of us feel when we are in difficult situations. It is not that something which is happening to only you. Any one of us, when we are in a situation which makes us helpless, will feel this anger or irritability, and it's a normal human experience. You have to validate your emotion. Then you need to change it. So how do you change it? So the moment you level your emotion, the moment you validate it, 50% of the stress that you are going through will go away. Because most of the time we do not focus on our emotions at that point of time. When we are going through that phase,
or anger or frustration, we do not focus what we are going through and what we are feeling. So it's important that we focus. So the moment you focus, 50% of your stress will go. The remaining 50%, how would you deal with it? So if we can reframe or restructure the situation in a way that right now I am focusing on the negative aspect of the problem. But if I can reframe the situation in a way that I start focusing on the positive aspect of the problem. See, I am stuck for 1 hour. There's a negative aspect because there is an incomplete bridge that has been constructed for last 8 months and you are suffering like hell. That is why I'm getting angry, I'm getting frustrated. But for a moment, if I wait and if I say that, okay, if this bridge, whenever this bridge is going to get over, when it's going to get completed, it will be decorated, there will be flowers, there will be lights, there will be plantation. I think my city is going to look much beautiful. And I can at least wait for another 2 months, 3 months for that thing to happen. So just by reframing, by restructuring the situation and focusing on the positive side of the situation will help you to regulate your emotion a lot. Right? And take help. If you're not able to help yourself by your own, then you take help. Take help to seek help from your friends, someone who is very close to you, very trustworthy. You can open up your mind without having any doubts that he or she is going to not keep the confidentiality. So talk to a friend, share your pain, share your emotions. That will help a lot. And again, by focusing on your self-care, that what we have just discussed previously about your eating habits, your sleeping habits, your physical exercise, the more you focus on those habits, the better you can regulate your emotions. Why is this like that?
Is it there?
Should I minimize it and fine. So there was another slide, like this, probably because of some reason it's not that clear. So there are certain things in this slide that I want to share with you, people. So first thing is, there are some critical skills that I wanted to talk about. These critical skills are somewhat related to what we have all gone through. So one most important skill is about time management, which is again connected with our routine. When you have a regular routine, it helps us in managing time. But still, there are certain specific things about time management I think you should be aware of. Time management means not avoiding tasks. Time management means, see, time is limited. Everyone is having that limited amount of time. But some of us are very successful and some of us are not. That's only because of how we use or utilize the time that we have in our hand. So it's very important that there are 4 things. I think if you can understand these 4 things, it will be very easy for all of us to at least manage our day-to-day life. The very first thing is, when you have a day starting the next, you plan your entire day before. So what you are going, the moment you are out of your house, what is the first thing that you are going to do? So you prioritize your task. Whatever it is, there are certain activities in our life which is unavoidable. We will have to do it. Suppose if you have a kid and you have to drop the kid to the school before coming to the hospital. So that is a task which cannot be skipped. You have to do it. So if you have to do it, the only thing is that you get out of your home a few minutes or few hours before so that you can put your child in the class, reach your working destination on time. So prioritizing your task. So first task in your life is suppose after your self-care thing, eating, getting ready, keeping your child to the school. That is your first task. So you prioritize it and then you allocate a specific time to it. Say 9 o'clock he has to be in the school, so I'll get out from my home 7:45 or 8 o'clock, and then I'll put him in my school and I'll come to my home. So the thing is that you will have to prioritize the task and you will have to allocate a specific amount of time for completing the task. So plan your day, prioritize your task, allocate specific time and minimize the distractions as much as possible. On the way, if you are meeting a very close friend, don't stand over there and start proceeding. And then you do not know how half an hour to flew away and then you reach your destination late. It should not be like this. When you have, minimize your distractions, including our cell phone, because that also is a distraction. Then there are cognitive changes. Cognitive changes is like, I just want to explain what happens like when we are in a difficult situation. There is a process which we call as cognitive distortions. So these are basically automatic thoughts that comes to our mind when we face a challenge or a difficult situation. Very common. Some of these, I'll just explain you. And in the real life context, I'm trying to explain. What happens is, one of the most common cognitive distortion is what we call a filtering. Filtering means that we selectively focus our attention to what negative things that are happening in our life. There may be 10 positive things that are happening with us, but we do not have a tendency to even recollect that for once in the entire day. We are just focusing on what is not there in my mind. So that is filtering. So for us, like as a doctor, if I am seeing 15 patients and then one patient come up and says that sir, your aapka treatment to bakwas hai, kuch nahi hota usse. The entire day I'll be thinking about that my treatment is bakwas. But then the rest 13 patients, 14 patients might have appreciated you. So sir, we are fully recovered, or we are feeling better, much better. It was nice, that we came under your care. So filtering happens to all of us. So there is, we tend to focus more on negative things and not on the positive part of our life. Another is personalizing. So the moment if a patient says that, okay, I am not well with your treatment, I filtered myself and then I personalize it. Meaning that I am responsible for all the bad things that are happening in this world. I am not adequate. I am not skilled. I don't know this. I don't know that. It's my fault. And that is why bad things are happening to me. So it's personalizing. We have a tendency to personalize things, which is again a distortion. It needs to be challenged immediately. Then catastrophic thinking. Catastrophic thinking meaning like the moment I think that I'm not adequate, I'm not able to treat a patient properly, the extremes of thoughts will come. That this patient whom I tried treating, he did not improve, he is going to file a case against me, he will sue me and he will say false things about me, my career will be at risk, my license will be cancelled, I will be behind the bars. That is extreme of negative thinking, which is called catastrophe. So most of the time, the moment we hear, okay, my son usually reaches from school, he reaches my home say at 1 o'clock. The moment you call your family members that has he reached? No, it's 2 o'clock, he hasn't reached. Your mind will start running in this direction. It will go to all the किसी ने उसको pick up कर लिया, accident हो गया, कुछ तो हो गया, कहाँ तो ले गया उसको. So this is catastrophe. Without having proper information about what is happening, what is not happening, your mind will pull you to an end of extreme. That is cognitive distortions. These thoughts need to be stopped and challenged immediately. Why am I thinking? What is the evidence? What are the facts that support my talk? If there is no facts, have I confirmed with the school authorities? He may be there in the school itself, maybe there is some practice, maybe there is training, extra training going on. Maybe I have forgotten and he was there. So there are a lot of things that happens. And polarizing. I think polarizing probably is the most common distortions that we come across. No? Polarizing means living in poles. Either it is a success or it is a failure. There is nothing in between. Either I am capable or I am not capable. There is nothing in between. Either it is yes or it is no. It's a very black and white kind of thing. If I'm working in this hospital, I have to be the best employee. Otherwise, I'm useless. So you are living in poles. That is unnecessarily, unduly, it is increasing your level of stress. Only just because the way you think, the way you perceive the situation is making it stressful for you. The environment is not that threatening, but you are making it threatening. It's only the way we think about it that makes it more threatening. So, cognitive distortions need to be challenged and it need to be changed immediately. Then there is positive self-talk. Even under stress, the moment you sit in a calm place and you say that I believe in myself, I know I have the ability to do it, I can do it, I deserve good things in my life, I will be able to do it. The moment you do this positive self-talking, there will be a sense of increased confidence. You have the motivation to go ahead, you have the motivation to take risks, fight against the stresses. So positive self-talking has to be done, and positive self-talking is the foundation of resilience. Like if you do not have the thing about yourself, a positive view about your own self, nobody can give it to you. It has to be there from within. It's an internal dialogue. It has to be there. You have to constantly motivate yourself by yourself. So these kind of statements are very important. Whenever you are going for, say, an interview or you are going for to start something new in your life, you have to say these things that I believe in myself, I have the abilities, I can achieve the goals I want, I deserve good things in my life. So the moment you do that, you feel confident. So when you feel confident, you can perform well. So positive self-talking is very important. Self-compassion, another very important thing. So self-compassion is like go easy on yourself. It's okay to make mistakes. It's okay to fail. There is always a next time to do things in a proper way. You have to believe in this. Because if you are not self-compassionate, hence you are judging yourself in the wrong way. Maybe you have all the abilities, but at that point of time, probably on a particular day, on a particular situation, because of many things, probably you could not perform, could not give the best what was expected from you. But that does not minimize you, that does not make you small. It was that another day that you are probably waiting for. So self-compassion is important. Then having a strong support system. Strong support system is just what we have talked about your social well-being. That you need to have friends, family members, maybe your teachers, your religious leaders. You have to have a bunch of people who can hold you when you fall. That is important. Having a good social life, having a good social support system is important. Not just emotionally supporting. We can support you in any ways. Financially, physically, always. So we have to have this support system. And lastly, the screen time. As of now, like these things have become a very, thing that has become the devil that we cannot actually identify. It's there with us all the time. It's causing all form of distraction, all form of killing our creativity and everything. But still, we are hooked to it in such a way that we cannot unhook. So, since we cannot unhook, at least we can be mindful because it is taking away the peace of your family, it's taking a part of your family. When you go back home, you should have, spend 30 minutes with your kids, but instead of doing that, you're on the phone. So that is important that we limit our screen time. Okay? And this is the take-home message from. See, stress is indispensable. We cannot remove it from our life, and no one is immune to us. Not that you are very strong physically, so you do not have stress. You are very financially affluent does not mean that you are immune from stress. Stress can happen to anyone. So you have to accept the fact that nobody is immune. Only thing is that we have to recognize our emotions, how they are affecting our behavior, and is it affecting our health too? If it is, then we have to seek for it. Okay? So this is a concluding statement is one of the renowned psychologists who has basically worked on stress for years, and probably he is the father who has defined stress. So he says that I cannot and I should not be cured of stress, but merely taught to enjoy it. And this enjoyment can only come through all the positive things that we have discussed, and it's important that we implement those things. It should not be just on slide and on discussions. I just hope that at least you can introspect yourself from today, that whenever you are stressed, that what emotions are coming to your mind, how your thinking is affecting your feeling, and how your feelings are affecting your behavior. Because this is a cycle. The first thing that we think, the way we think makes us feel, and the way we feel makes us act. So if you are thinking positively, you are acting positively. If you are thinking negatively, you are acting negatively. So that is the basic thing that we need to understand. Thank you. And if anyone would like to ask anything, I'll be happy to